All right, everyone, welcome to another episode of Badass Clinicians. Today, I have the most famous TikTok dancer, Instagram dancer, Dr. Danny Shapiro from Brooklyn. BK, stand up, everybody.
What?
Yeah, so Danny, welcome to the show, man. I met Danny like 2 weeks ago in Clearwater in our business conference, and this guy is massive if you guys see him in person, and he's also a vegan, which I don't believe. I think somewhere out there, if you guys see Danny eating a hamburger, please tag me so I can expose this man. It's not possible to be this big and be vegan. But anyways, enough about this. Danny, welcome to the show, man.
Thank you, Natty. Really appreciate it. I am naturally vegan.
Naturally vegan.
No
Born
test,
vegan.
Well, I wish, but no. No test boosters, no meat. If anybody finds it, it's all Photoshop. I'm telling you right now.
Oh my God, that should be a challenge. Can we Photoshop Danny eating a hamburger?
Oh, good luck. Good luck.
So let's get into it, man. Let's tell us, the listener who are obviously PTs, clinicians. Let's talk about your journey. You know, obviously it's really interesting. So let's talk about where you were undergrad, how do you get into PT, where do you go to PT school, etc.
Sure. So before physical therapy, I was actually a professional ballroom dancer for 16 years. I was a U.S. champion when I was younger. Really, very big on the international stage. I was very, very active throughout most of my life. Now, what I chose to do is, I always loved anatomy, the human body, and the reason why I became a physical therapist initially was because at these competitions, I would see people getting injured right and left, and I just didn't understand it. The dancing world did not have any kind of medical backing. It was like, if you found a doctor, great, but nobody really cared. You pop an Advil, you continue dancing, continue going. So I wanted to kind of like dive into and figure out like, well, what's going on with the body? Why are we all getting injured? So actually, I started undergrad here in the city, and then halfway through I left to Amsterdam, where I went to a physical therapy school there, and that changed my life. That was insane. While there, I went through the traditional PT training, but I actually graduated with a couple thousand more hours of experience compared to someone graduating from the U.S. school. And that was because over there was an extra learning opportunity where you can sign up with this like sports company, and they'll put you into different sport clubs. And I went into first semester, and about a year and a half in, still as a student, a year and a half into my education, I was offered to be the head student PT, but still the head PT of my own team. So I would travel around all of the Netherlands with this team as the primary physical therapist. There was no CI. It was me alone with this team, like 3 hours away from the main city. And it was my job to assess, to evaluate, to treat, to, if someone broke their thumb, which they did, and it was hanging on by a thread, it was my job to make the clinical decision. Do they continue on? Do they get off? I've had to call an ambulance onto the field. I was with a rugby team.
Okay. So I was going to ask what sport.
Yeah. Rugby. Yeah. Wild sport. I saw all the trifecta knee injuries, the meniscus, ACL, MCL, all torn at once. Like, it was really, really crazy experience. I was doing that for all 4 years. So when I was done, I felt like I've seen a lot.
Yeah.
And I was just ready to rumble and get to work.
So let's talk about how they picked you to be like the head clinician when you were a student. Like, what do you think you did differently compared to other students that gave you the edge to be the guy?
Well, I was just really hungry. I really wanted information. Sports fascinated me. And yes, I was still a student. Was I anywhere close to being ready to run my own show? Absolutely not. But I was hungry for information. I was confident, and the people who were above me when we were in the actual main club, right? Because at the end of the day, I was still a student, right? So when we were at the main club, I still had a CI, I still had someone telling me what to do. But when we would travel with that team, I was assigned a team, I was alone, nobody there, me and the players. That's it. So I think when people see that you're hungry to help, you're hungry for knowledge, you're hungry to learn more, you're hungry to excel, I think that is really what makes the choice obvious of like, okay, this person, let's give him a shot. They actually gave me a shot earlier, but I kept pushing it off because I wasn't confident.
Yeah.
And then I was like, you know what? Why am I not confident? Let's just do it. And then I did my first game. It was awesome. saw so much, and then just I've been traveling with them ever since. So yeah, I mean, and then also because of that experience, they also towards the last year there was the Amsterdam Sevens. It was like a really really big intense tournament. I was always chosen to as first pick to go and be there with the team. So
wow, that's great, man. I think
it was awesome.
I mean, I just talked about this on another podcast of what I really admire and who I would hire is someone who's always hungry to learn, who's always a learner. And that's how I feel about myself too. Like same situation. I remember working my first pro class. I'm like, shit, I don't know what I'm doing. And then I'm just like, but I know how to treat people. So I was like, why am I making this bigger than what it is? Human body is a human body, and sometimes you psych yourself up a little bit more. And I'm sure now looking back, you're like, oh, that's nothing. I can do that 10 times over.
Yeah. I could do it in my sleep. Wake me up at 3 a.m. Okay, all right.
Yeah.
Tape up some ACLs if we need to. Keep on playing. We got this. Yeah.
And so you were doing that throughout your whole academic career in the Netherlands. Mm-hmm. And then when do you decide to transition back and move back to the U.S.?
Right. So I mean, I had that extra experience there, but I did my rotations. I had three of them, and I did each one in New York. So I always knew I was going to come back.
Oh, okay.
It was just a matter of getting there, doing it, finishing it, transferring all those credentials over, and then starting my journey here. So I mean, I always knew I was going to come back to New York and try to own it. Mm-hmm. I mean, own all of New York State.
Yes, all of it.
Be
Buffalo.
Be the PT of New York. Everything. Own a little chunk of Canada too. Whatever. Yeah. No. But in all seriousness, I always knew I was going to come back to New York, and I really wanted to take all that information, all that knowledge and experience, both from the Netherlands as well as the rotations, and just make something more, but give back a different level of care. Than what people are used to, especially, I mean, again, I don't know how things are here, but Brooklyn, where our office is, it's such a poor level of care. It's like bottom of the barrel, just worst of the worst. And then people wonder why they're still in pain for so long. We have a PT in every block. We have a PT across the street from us, two of them actually, one around the block, one down the next block, two more down the other block. And people are in pain, and it's the way things are run. It's no surprise. Yeah,
if you guys can hear, there's an alarm going off every time we mention bad PTs. There's an alarm to make sure that it's a real thing. It's a fact check. And it's so funny, dude. Back in the day, someone told me this, like my old CI at some point, where back in inner city, right, especially in Brooklyn, they used to just open up fake physical therapy and ask people to come in, sign their name for Medicare, and then bill Medicare, and then as soon as the checks come in, they split whatever the reimbursement was with Medicare with the patient, and they do nothing. So, I mean, from that perspective, that's where you're starting with. So, going back to the school, doing rotation in New York, what were some of the things that you see that were so vastly different between what they were doing in the Netherlands and what we were doing here when you were in PT school?
So one of the biggest reasons I chose Amsterdam, why go to Europe? Why leave the country? Why not go to PT school here? Yeah. One of the things that was different that's over there is that there's a very big emphasis on manual skills, but more importantly, movement interventions. Everything is based on movement. Even the whole rice and price thing was really not used over there, really. They always emphasized, pain-free range of motion and just getting the person back, because it's understandable that the faster you get back to movement and actually being able to move the body, the better you heal, the faster you heal. So I love that. I mean, I'm not really in this to use the electrotherapy, the ultrasound, especially when
passive modalities.
Yeah, because that doesn't really do much. If we talk about even if you look up at research, right, there's tons and tons of research that movement is always beneficial, or movement and manual therapy combinations are always more beneficial than passive modalities, right? So if we're talking about bang for your buck and more, how can we get this person, regardless of the injury, how can we get this person closer to or beyond 100%? How can we make that faster? Yeah. So Amsterdam they really emphasized that. We covered modalities for 2 weeks, and the machines were from 1990s.
Way back.
Yeah. It was covered in dust. They had this weird drape thing over that they took over, and then it was 2 weeks ago, and then done.
And I want to go over more. So obviously you were thinking differently. So during your rotation, you definitely encountered some CIs who were doing old school way of thinking. And I encountered this too because my background was in strength conditioning before. So when I have people do all these loading movement, progressive loading, deadlift, squat, people are like, what is going on? Why are you guys doing this? And I know students that are listening to this are going through this right now. So how did you deal with that without, sound like a dick and without making your CI feel bad in a way and still pass it, right? Because usually they can fail you if you really bruise someone's ego. So how do you overcome that?
It's good to know that we can curse here. Great. All right. So actually, I've never publicly told it. I've done a lot of different podcasts before today, different episodes. I've never actually spoken about this really in depth.
Exclusive
Interview.
Yep.
I actually almost quit being a PT.
Okay.
This was my last rotation. I'm not going to name names, not going to say the practice, but I almost stopped. This was the most abusive, horrible experience of my entire life. And this is coming from a ballroom dancer. Right? So a lot of people who don't know, ballroom dancing is a very cutthroat industry.
Dance mom all the way.
Listen, it's bad. Listen, it's real bad. Like if you're seriously into the dancing world, they will chew you up, like eat you up, spit you out, stomp on you a couple times, and repeat the process over and over again. If you're in a high level, so this was this kind of emotional.
So you're already used
breakdown.
to the abuse. You have high abuse threshold.
Oh yeah. Okay, it's like people say, "Oh, a high pain tolerance." Oh, okay, I have a high abuse tolerance. And let me tell you, I almost quit. I started doubting myself. I started just thinking that, what am I even doing here? Like I feel stupid. I feel dumb. It's beyond just like, it's not. Asking questions or quizzing. Like I was literally doubting everything I was doing because of this CI's approach.
Wow.
It was terrible. And from that moment on, I promised myself I would never, ever treat a human being like this, especially if I brought on students or interns. Never in a million years would I even think to treat them this way. But especially more reason not to do that. There was no support. There was no encouragement. There was no positive anything. It was miserable. And speaking of which, like when we talk about approach, right? They had a very particular kind of approach. Not good, not bad. It's nothing about that. But one of the things that actually came as a byproduct of my education in Amsterdam is I actually came up with my own manual therapy technique.
Oh.
It doesn't exist anywhere. This is like
another exclusive.
And it's called myo-melt.
Okay.
So muscle melt, right?
Okay.
So I started applying this kind of manual technique with movement to some of the patients that were thrown my way. Now, lo and behold, I remember this one particular patient, shoulder pain patient, has been going to this PT for probably 3 months or so. No results, nothing, just barely minimal improvement. Every time there'd be like a 10-15% improvement, it would just drop right back down next week. Started working with this patient. Within the first week, the patient started noticing tremendous gains, like range of motion, strength, all that improved. Pain drastically dropped. Tremendous gains. And they stayed until the next week, which this patient was, okay, well, that's weird.
Yeah.
I've been going to this guy for 3 months. Student comes along, okay, and now the results are actually starting to stick. And so what ended up happening over the next couple of weeks is that this patient started requesting me instead of the head PT, my CI. So my CI actually pulled me to the side and he's like, you better stop what you're doing. You better stop that right now. You better stop. What you're doing is nonsense. It's bullshit.
It's working.
It's working. The patient's requesting me, right? But then we talked about, like, when you asked me, how do you not step on anybody's toes and how do you make them feel bad? They literally put me to the side and said, this is bullshit. What you're doing is nonsense. You're giving the patient false hope.
Wow.
All right? Giving the patient false hope because you're giving them results. And they're like, holy shit, pain-free reality is actually possible. And he pretty much told me to stop everything that I'm doing. Or just like, it's just, and that was nuts. To me, that was crazy.
Yeah. That was so unethical in so many different levels.
It's nuts.
Yeah. How do you deal with that? Because you're doing the right thing, but then your career is also on the line. Like, where do you teeter the line? Like, I never had that kind of experience. Like, I'm unfortunate in that where I have to see, we're like, hey, I like what you're doing. Can you show me how? I'm like, great, let's work together. Actually, I had someone that pulled me aside and say, like, you're too comfortable with the patient. I'm just like, wait, what?
What?
That's beside it. Yours is way worse. So
yeah.
How do you manage that? Because I mean, someone here listening, maybe like 3 of them might be going through that.
Listen, as a student, unfortunately, as bad as it sounds, you have very little power. As a student, you're at the whim of obviously the institution, but you're also at the whim of the CI. If the CI chooses to say, listen, you're doing dog shit, I'm telling your institution, telling your school, I'm not going to pass your rotations, you kind of can't really do anything. So at that moment, I was like, well, I realized that I can't do anything. If I continue to step on toes, it's not going to help me get out of this and actually change the system from the outside. Right. So I mean, I tried to dial it down, but to me, it just didn't make sense. How can I do something that I know doesn't work versus something that I know will work for this patient? How can I, as a clinician, as a future clinician, go through that? So I started to do other things that I knew would still put the patient forward. And actually, I never got that patient again. They did not show up on my schedule. And I know why that happened. Yeah. But for any other patients that were thrown my way, I just tried to keep it just simple. Yeah. But I knew it was frustrating me the whole time. And I remember I had another about a month and a half, 2 months left of that rotation. And every day I hated going to that place. Not just because I didn't have the freedom to actually help people who he was giving me, but because it was such a negative, bad environment. If you're stuck in that environment, if it's not too late to switch out and go into a different rotation, then you just got to stomach it. Unfortunately, again, there's as far as I know, there's very little that you can do without setting yourself back, and you're much better off just finishing and then changing the standard once you're out. Yes. And that's what I do through social media as well. Not just stretches and exercises. I try to give people a new standard. Window shopping for PTs is important. That's actually a message I advocate a lot. Yeah. Finding the right provider for you. And that's what really people need to do, because again, if you're at a place for 3 months, you got to be seeing some kind of results. That's it has to be.
It's so weird, man. All right. So a couple things I want to touch on. So I was reading some sort of philosophy book over the weekend, but they were talking about whether when you have two choices, right, to choose short-term pain versus long-term pain, go with short-term pain that will give you long-term gains. And that's what you did. You choose the short-term pain to shut up, put up with it, because the long-term gain is that you're going to be able to get out. You can change the field the way you want it to. You can treat the way you want it to. And you can help the patient down the road you want it to. The field needed you more in the long term to actually change than we didn't need you in the short term. Because you as a physical therapist, right, you will help tens of thousands of patients. Your message will help other PT, right? So now your impact scale is up higher. You're more useful swallowing your pride in the beginning, right, than you are. If you were to nope, I'm going to do it this way, you're going to get kicked out. You're probably not going to be a PT. And guess what? That guy's still going to have his practice. You're not going to change anything. So now I appreciate that so much, man. I think people need to hear that. Just because sometimes, dude, it sucks. You're a student. You're literally, this is why it sucks so much. You pay to work for free. Yeah. Yeah. So just understand that. But just know that whatever you see is not ideal. You can change it down the road. And it doesn't have to be a drastic thing. You can get 1% better and better. And I appreciate that so much, because it's probably not it's not the advice that people want to hear. If you go on any, group chat or anything, all the other PT students be F that, quit, report. But it's not going to do anything. The fact that you took the high road in a way, and that all right, let me just stomach through is 10 weeks. It's painful 10 weeks. And then I'm just going to do something later down the road. So I totally appreciate, because the field need that more than anything. And second point, window shopping for PT. I think it's fantastic. I made a post a couple months ago that people spend way more time figuring out who's going to be their hairdresser than they do who's going to be their PT. Yeah. Right? The amount of Google review, my wife would go oh, this girl's really good at highlights, but she's not good at haircut. And she's making all this pros and con list, right? And it's why aren't we doing that for PT? It's again, any, even, what's it called? Mechanics. Yeah. You need to be able to find who's the right fit for you, right? And I think having social media is great to do that. So I appreciate those 2 points. So let's talk about your journey. As soon as you're done with that, you pass your board. Did you start your practice right away? How did you go about refining your skill set, you know, because obviously you're an active learner, you have your own, you know, method already. And obviously you developed that through different learning experience and what you did in the past. So how do you keep niching down to end up to where you are right now?
So, I mean, once I passed the boards, like I opened up my practice right away, like, which is kind of crazy considering that, you know, it's so soon after being done with school. But I was ready. I was ready to make a change, and I was ready to make an impact. And so the moment I was able to, I opened up my own practice, which was, I believe, 2-3 months post receiving my like official pass and getting my license. And then listen, like research, EBP, important. Not everything, right? Because, you know, having EBP is a great guide, and that's what I look at evidence-based practice. That research is a great guide, right? When they have these giant sample sizes of 1,000 people, if you're looking at a meta-analysis or something like 10,000, 5,000, whatever it is, like not everybody fits into that group of like this person got better with this. So it's really, you know, taking everything with a grain of salt in terms of information gathering, but really treating every patient as their own, right? If I have 20 people come through my doors for low back pain, let's say, all those 20 patients will be treated pretty much all differently. Every low back pain case is a little bit different. Even if they're all disc herniations, not every disc herniation is the same. Not everybody's response to a disc herniation is the same. So it's really about, you know, from a practical standpoint, being able to look deeper into the patient and learn from the patient, right? Field experience is really, really important. And as a student, if you're listening to this as a student and you're going through your rotations, absorb every little tiny thing. Not every ankle sprain is the same. Not every ankle sprain path to recovery is the same. Not every individual is the same. Everyone has different goals. So if you absorb as much as you can from every client, from every patient, from every case, from every injury, any kind of injury, even if 50 of them are exactly the same, they're not the same. They're not the same. And I think that is where really I grow as a clinician the most. From cases, from treating everyone as their own individual case, not the research, but the actual treatment of the patient is where I really, really grow. So, I mean, comparing myself to when I first opened my practice to now, I mean, I still have so much to learn. There's still so many cases to see, so many interesting things that, like, so many different kinds of injuries that help you grow as a clinician. But yeah, that's really where I do all my growth. Every time I see a new case where it's like, what do I even do here? And then, you know, a few weeks later, the patient's feeling so much better. Actually, I'll give you a quick example. There's this case that came across me. This one it just blows my mind. The guy comes in with low back pain, radiating pain across like through the rib cage into the like right on the inside of the rib cage, maybe around like rib 7, rib 8. And really, really pointed pressure right in that rib cage part. And he also had ED and breathing issues. So erectile dysfunction, breathing issues, cannot breathe normally, rib pain, radiating across through the rib cage and into the low back. He's had every test under the sun. He's done everything, all the MRIs, the CT scans, the everything. They checked inside, nothing. He did not have an explanation for this kind of pain. There was no explanation for why he had such trouble breathing. He had no explanation for the rib pain, the radiating pain, the low back pain, the erectile dysfunction. Nobody could understand what was actually going on with this guy. And to top it all off, because modern medicine in the States is so amazing, he was put on antidepressants. Well,
yeah. Listen, I know you have ED. You're probably a little down.
Right? Yeah. But nothing changed.
Yeah.
Nothing changed. He's been to the YouTube famous chiropractors. He's been to these doctors and those doctors. No change. Within 3-4 weeks, he was fully back. Once we started getting to work.
Yeah.
Rib cage was done. Radiating pain was gone. Low back pain was gone. ED was practically non-existent. Breathing patterns were established. No issues. And the guy was able to move on with their life.
Yeah.
Been dealing with it for like 3 years. You know? When he first came to me, I was like, I have no idea where we even start.
Yeah.
But we started. You know, very upfront with the patient, very just like, listen, like you found me, you came to me, like I'll give you everything. We'll try our best.
Yeah.
Like, listen, money back guarantee, no problem. Like, you know, as long as you feel better. And like we're gonna take it step by step, see how it goes.
Yeah.
And you know, a full turnaround. So that's where you learn.
Yeah. No, I mean Seriously, man. I mean, it's all going back to ownership, right? So you starting your practice, like as soon as you got out, I started my practice like a year after I got out. Like we have that ownership. Like we have to make it work. This is your name. Like, so as the thing that they don't talk about starting a business, that you bear the highest risk. It's your name on the door. If something's messed up, they're coming for you first. So, the fact that you have that extreme ownership to make sure that they get the best outcome, it's something that I feel like that might be the thing that we're missing as a profession. Like, are you able to own up to the outcome that your patient get? Are you invested to make sure they get the best outcome possible? Are you doing your best possible? Because you and I as business owner, we have to make sure we do our best. That's food on the table.
Yeah.
Like, like you're working for someone. It doesn't matter. Like you get your salary, great. And most PTs that go into PTs, like they want to have stability, right? That's why I went in for stability, man. Do you think I want to work 6-7 days a week for like the past 3 years? No, but just like you, I saw change. We needed change. Nothing really was going to happen within the field, but that extreme ownership, like I am so invested in my patient's well-being and the outcome that I will do whatever it takes to make sure they get the outcome. Like I have I have someone who like constantly passed out, and we're like, what the hell happened? And then he's like shortness of breath, this and that, same thing. And all we did was like, hey, let's look into the diaphragm. Maybe he's just not breathing. The vagus nerve's compressed. Like just doing outside the box thinking for a little bit, not going to like real like voodoo magic stuff. But the fact that you have to think outside the box, because sometimes the evidence only suggests the best available outcome based on previous data.
Right.
So exactly. You have to, but then like if we go based on previous data, ACL would never progress because they used to cast people right after ACL, right?
Yes.
You would never make progress. So you have to think outside the box. You have to willing to try and be upfront and say, yo, I don't know this. I'm going to try this. If this works, great. If it doesn't, we'll scrap it. We'll try something else. But if you are invested in someone else's outcome, which is your patient, you and I, like PT, we're artists. Let's just put it this way. What we do is art. And we have to take pride in our artwork.
The investment, the drive for and hunger for success for our patients, right? This is not just like next, all right, next patient, let's go. It's not a walking dollar sign through the door, right? Obviously, they pay us for our services, obviously. But it's not just a simple give us money kind of transaction. We will take you and we will try to figure this out as best as possible. And I think more clinicians need to approach that. And I understand it's kind of like it's really hard to do that because when you're in a system of like a PT mill, right? We everyone knows this phrase, PT mill, right? Where it's a big institution and they're just trying to pump patients through the door, right? Fill out that insurance information, just pump it. It's very hard to invest in your patients when you're seeing 25, 30 patients a day. It's very hard to do that. Even 20 patients a day, 15 patients a day, it's tough. It's tough. When you're just like as a PT, whether you're a student or a new grad, working for a place, and again, I'm not going to name any clinics, but it's really tough to invest. And, I also understand that too. When you have to see 4 people in an hour, I mean, that starts to get kind of stressful. Yeah. Especially when you are not free to do what you need to do to get that patient better, right? But I think that's what makes us different is that we kind of like create our own system, right? We create our own box to actually help the patients that come through our doors. Right, and that's why they're so successful. I mean, like, listen, I just you showed me your room earlier. I was like, I got all tingly. It's so exciting just to see so much equipment, so much things where people can really focus on movement and getting stronger and getting better and faster. And it's really, really awesome. So again, you as a clinician thinking outside the box, trying to get the best outcome for the patient is really, truly amazing.
No, and I love talking about this, dude. Like the whole PT mill. Like obviously, I went through it. You've been through it through rotation, right? I argue that because of those time, I am a better clinician for it. Like so, I'm always like I know how to cue. I can cue a good like deadlift from like 3 miles away, just because I have to be so efficient with my time, right? It's not going to be roses and gold wherever you go, right? Even like you and I seeing one-on-one, that's still tough. Like you still have to be fully engaged. Absolutely. I argue sometimes that's a lot harder when you have someone that's like is not very talkative and it's 7 p.m. at night and you're just like trying to get through it. I always give advice where get the best out of those busy scenario. You get so much volume. How fast can you get these people better, right? Can you get better at your queuing? Can you get better at like assessing? Like, can you just do like a quick screen, be like, oh, I know what I'm gonna have to do now. Like just based on those things. And I think what people are trying to do now, they're trying to have this global top-down approach, right? People want to fix all the dysfunction in one day. It's not possible.
Yeah.
You know, like even like us with our one-on-one setting, we still focus on the small goals.
Of course.
Right? And you have all these different courses that teach algorithm and all that stuff. But what's missing is the person in front of them. Like these are not spreadsheet. I'm not putting in X and then it's spitting out this outcome. That's not how it works, right?
Exactly.
So going through those like busy clinic will definitely give you like there's silver lining in it. Like I know how to queue well. I know how to treat patients. I'm pretty quick on my feet. And you know you have to be quick on your feet, especially when you own your own business.
I mean, absolutely. I mean, that's kind of like what makes things work. Being able to be really quick and adjust to where you need to. But, you know, but you're right. Like when people work in these really busy settings, like this is an opportunity where you can actually learn to hone in and like, okay, how do we make a 5-minute conversation 2 minutes, but still equally as effective as a 10-minute conversation about the same 5-minute thing, right? So, you know, whether it's queuing, whether it's information, whether it's really making things super, super clear, whether it's, you know, advising of what to do, you know, for as an HEP thing, right? Like what can the patient do at home to further the success that you do in the office? And actually, I would say that what people do at home is even more important than what they do in the clinic with you. If, let's say, a typical appointment is about an hour, where let's say they come to you twice a week, that's 2 hours out of what? Like how many hours is there in a week, right? 170 something, whatever that number is. Aside from sleeping, aside from working, what can that patient do throughout their day to day, to help them get back to 100%, right? We're the sessions are the guide. Like, yes, we can do some manual stuff. Yes, we can do some movement stuff, some cueing. But again, that's ultimately, if you really think about it, it's a guide helping the patient get to being individual and independent.
Yeah.
Right? Again, but it starts with like, what can they do at home as well to take them step by step to make them feel their best, right? Again, what we do is magic. Yeah. Right? Pixie dust, Peter Pan, all right? We create the magic, but we need to help them create the magic at home too. And again, that just comes all like full package.
Yeah, I mean, the magic itself, man, it's just to show that people are capable of doing this.
Absolutely.
To get them to believe in themselves. That's the biggest part. I think that's what we do really well as a profession. I think we're able to see both sides where we know how to get people out of pain, but also know how to get them stronger. I think what I would love to see us as clinicians is we need to be more hopeful for the person in front of us. We need to see their potential more so than they can't see it, right? We need to be their own like personal hype man. Yeah. Like that's our job. And then from there, just build from that and just like, hey, you can do it. Here's what I need you to do at home. Not like 8 million things. Just like, hey, go to bed earlier. Yeah. Hey, do this. Hey, do that. And that's all you do. You build relationship. And you know what? I wouldn't have a successful business right now if it wasn't for the amount of patient I treated in a busy clinic, right? And I try to own those results as much as possible. You know, was I stressful? Absolutely. Was I burned out? Yes. But, you know, there's always something to be learned through those hardships. Just like you took it upon yourself to run those rugby teams. You didn't have, I mean, I'm sure that was an insane environment.
It was nuts. And I could have said no, but dove in.
Yeah. So, I mean, let's dive in. Obviously, you're a business owner now. Like, what do you think are some of the main factors that make you a successful business owner now? How do you keep your clinic? I mean, started 2018, right? No, you graduated 2018.
Yeah, I started the clinic in. I mean, it was COVID started 2020, right? Yeah. And we started it January 2020.
Great timing, just like everybody.
It was wonderful. But listen, I gotta say, like one of the things that I find when people come to my office, one of the things that I find from as their feedback, some of the most ridiculous things I've ever heard in my life. whether it's from a PT, a chiropractor, they're some sports legendary doctor from NYU or Columbia. I hear really, really ridiculous things. And as PTs, whether you're a clinic owner or a PT, whether you're like new student, well, student maybe not so much because again, you don't have full autonomy.
Yeah.
But wherever you're on your PT journey, one of the things that really made my clinic, me, successful, is not being scared of not just of, I mean, not from an entrepreneurial side, but not being scared of the person in front of you. I can't tell you how many times a patient has come to me and they've been told by a previous PT, never lift your arms up above your head. Why? Fuck you mean never lift your arms above your head? Like, you know, to a 28-year-old who's a professional athlete, like, how are you telling this person not to lift their arms? There's no clinical, first of all, there's no even clinical reasoning because of it. Oh, because they have a couple cervical disc herniations, they cannot lift their head, arms above their head? Really? Right? Otherwise, the person can move, but they're forbidden from it. Right? Or people who are told not to squat. Yeah. For what reason? You squat every day. Do you not use the bathroom? Right? Do you not sit in a chair when you have breakfast or eat dinner? All right, it's these really asinine suggestions that are either outdated or driven by fear from the clinician when they don't understand the person in front of them. But when you strip away that fear, right, and a lot of times it is fear or just super cautious, like being super cautious for no reason really, tremendous things can be done for your patient. And this is exactly what I figured out. The less scared you are of what it says on their MRI report or their X-ray, the less scared you are of experimenting with those patients who haven't squatted in 15 years, but they do functionally squat, but they actually haven't actually broken it down. They're scared of sitting down or standing up, right? But just continuing to avoid the things that are currently still a problem in this person's life, you're not doing them any good. You can do all the manual techniques you want. You can do all the fancy schmancy explanations, but if you don't get the person to achieve their goals, be it functional or professional, and you don't get rid of that fear, you will not move on as a clinician. You just can't. Yeah. Right? Because then you're putting yourself and your patients into the same box. Right? And going back to that outside the box thinking, right? How do you get those people to do the things that you need them to do? Right? And this 28-year-old, I mean, he's been in pain for 10 years. Yeah. Right? Like head to toe pain. Told never to lift their arms above their head. Told to never do a push-up. Told never to do an actual squat. Okay, yeah, great. Start working together. Start doing all those things. And guess what? No extra pain. Actually, pain was gone. Right? We all know, you know, if you don't use it, you lose it. That's an actual real thing. You got to use the available range of motion. You got to get stronger. But again, that's one of the biggest things that really helped me grow as a clinician. Strip away the fear, right? You know, be within reason and like, you know, don't overdo anything to hurt the patient, obviously. Yeah. But strip away the fear from just because they say they can't or, you know, research says you shouldn't, it doesn't mean that patient follows any of those things. Yeah. Right. And
I love this, man. I just had a meeting with my team about this, is where we are as in a healthcare, right? We collectively, doctors, whoever it is, make our money in a fear-based approach, right? We like the negative label. We love negative label. Like, oh, you shouldn't do this, you shouldn't do that. And I'm always like defining in some way, where if someone say like something that they can't, like if someone tell me I can't do something, I was like, no, I'm gonna prove you wrong. Or if someone come in and be like, hey, I can't squat, I'm like, all right, what I'm gonna do is I'm gonna finagle my way to get you to do a squat by the end of the session, just to prove that A, you can, and B, that you should question a lot of stuff that are being said to you, because these are functional movement. You need to be able to do these things. So I guess we're the same way in that regards, because I'm always like, so how is that a thing? Like, why? Like, what's a good reason behind that? And, you know, for any clinician listening, yes, understand the protocol. Sometimes you work with surgeon whose protocol was 20 years ago. Sometimes they're has very big ego and they don't want to listen to anything. Listen, you have two options. It's just like going back to your scenario with your CI. It's like you can hop on the phone, call that surgeon or whatever it is, yell at them, ruin the potential relationship, right? And then not able to help this patient because they're not going to send you another patient. Or you can just say, all right, great, thank you. I love the protocol you sent me. I'll use that as a guideline. And then from there, you just slowly work your way. And then, you know, it's like following a recipe, right? Once first you don't know how to cook, you're just like, I'm going to follow this to the T.
Mm-hmm.
And then now you learn how to cook. You're like, all right, you know what? I'm going to throw a little salt in there. I'm going to throw a little oregano. And next thing you know, you come up with your own dish. And I think that's what we need to approach as when it comes to, you know, treating patients. Like, use it as a guideline. Don't be fearful, like you said, but understand that you should question everything, and you should question everything on your patient's behalf because you need to be able to see their potential.
Exactly right. Exactly right. And you can question everything as a clinician and as a student, right? If you see your CI doing something, you know, politely and in a way that's not stepping on any toes, why you're doing this? I've seen you do this for the last 10 patients. Like, would something else be more beneficial, or like what is the purpose of this? Like, why are we doing what we're doing?
Yeah.
Are we following just a routine kind of like, you know, circle kind of cycle thing going on without really thinking of what is in the best interest of the patient, right? What do we actually need to, what kind of spice do we need to add? You know, is there too much paprika and we need more garlic salt?
There you go.
Right? Yeah, like these are all things that are really, really important. And again, that's what makes the therapy unique and different than what the patient has been used to. A lot of the patients that I see, they've been to 3, 4, 5 other PTs, chiropractors. I mean, I was once working with a girl. I love to use her as an example because she saw 10 people for her hip pain. She was a professional ballet dancer, and she saw 10. I was the 11th person, and it's like, well, how?
Yeah.
You know, like how are we getting people to this point where they have to see provider after provider, you know, with the same thing? Like, everyone's doing the same thing. I just had another girl come in. She's post hip surgery, and the surgery happened a year ago. She's been through 3 different PTs. They're all doing the same, you know, slightly different version of the same thing. And a year later, she's in worse pain.
Yeah.
You know, and it's very frustrating to hear these kinds of stories because, again, I love this profession, as I'm sure you do.
Yeah.
And you know, in the sense, like, we want all PTs to be successful. PT is hot. You know, it's a juicy profession. It's where you really get to know people. It's where you are. It's different than a surgeon, right? Surgeons, they operate on you. You're passed out. You're out. You wake up. You don't really. You maybe see them 5 minutes, talk about some stuff, and then that's it. But with PTs, it's real. It's a real relationship-based kind of scenario where you really get to know the person in front of you because you're helping them get to where they need to be. And I think really, again, like kind of like what we just said last, you know, over and over again, we need to step outside the comfort zone. We need to get comfortable with being uncomfortable, traveling outside of the recipe, right? Finding out what is the best thing for this patient.
Yeah. And I love your approach. Like the fact that you're the 11 PT and you had, again, going back, we always had a crossroad, right? Am I going to be the 11 PT that fail her, or am I going to be the 1 PT, the first PT that actually help her?
Oh, I didn't fail, let me tell you that.
Yeah, so the choice is always there. Like for you guys listening, right? You actively, when you get up in the morning, you actively make decision, do I want to help and serve people, which is what I'm supposed to do in this profession, or do I want to serve myself, right? If you want to serve yourself, I'm sure you're not going to listen to this podcast.
Nope.
It's not for you. And it's not a good feel for you anyways. Because you're self-serving, you're driven financially and all of that stuff, you know, this is not it for you.
Yeah, and look, money will come.
Yeah.
Right. If you treat people well, listen, word of mouth is going to spread. Right. Money will come, but again, you cannot be focused around give me everything. Yeah. You know, you gotta deserve it. You know, you gotta give to get. Yeah. And if you don't give the right stuff, you should not get either. Yeah. You know, again, in our clinic, we have 100% money back guarantee.
Yeah. Same here. Like that's another thing. Like how confident are you in the product that you put out in your art, right? Are you willing to say like, hey, would this person hire me again as a PT? Right? That's something you need to always ask yourself. It's got to be an ongoing self-assessment. Yeah, exactly. Because again, you got to bring the best forth. You got to bring the best product forward. Yeah. Right? You got to give them an option, especially if they've been to multiple places. You got to give them something that's going to wow them, that's really going to be beneficial to them. Yeah. Right? If not, if you're just like everybody else, if you cannot provide the product, if you cannot provide the relief, the sense of hope and improvement, again, that's why we have those things. It's like they're there because we're that confident that we can be the change. We can give you what you're looking for. You know, we're going to bring you as close as humanly possible or beyond what your expectations are or what your goals are. But again, like we're that confident. There's 100% money back guarantee. Listen, I don't know like about New Jersey, but I can tell you in Brooklyn,
I don't know of a single medical facility of any kind, regardless of the specialty, whether it's PT, chiropractor, dentist, doctor, doesn't matter. I don't know a single person who has 100% money back guarantee.
Yeah, probably not many.
No.
Yeah.
You gotta be real confident.
No, that's
you know. So
no, that's huge, man, and it's just I love it. I think if we're gonna end on any note, I think that's a good note to end in. Again, I really appreciate your time, man. I think you dropped some really good knowledge. Thank you for sharing the story, especially what you went through when in PT school. I know a lot of people can relate to that. And lastly, where can people find you?
Yeah. First of all, thank you for having me. It's really great. When I was talking about the whole CI situation, I even felt my heart start to race. So I still remember it like today, like it was yesterday. And I just want to say, revenge is sweet, but especially when it's not at your own hands. I mean, I must say his clinic closed. And I'm not going to say if I was happy or sad, but I'm definitely not going to say it was sad.
Yeah.
But yeah, in terms of working.
And you weren't surprised either.
I wasn't. Well, no, I wasn't surprised. Yeah. Listen, the way you treat your staff, the way you treat your students, it's a very big reflection on who you are and how you run your business. So always be kind. Yep. Always. No, it doesn't matter to who. Always be kind.
Yeah.
But in terms of where can people find me, I'm on Instagram, official Danny Shapiro. I'm on TikTok, official Muscle Whisperer. Yeah, you gotta whisper it out. Whisper it out.
I love it.
Yeah, and you're gonna see there's a lot of dancing content that's included as part of the experience of social media. Yep, it's a fun time.
Yep, dancing, hips movement, but also some good information. I mean, guys, reach out to Danny. Please connect with him. He's great. If you're in Brooklyn, check out his spot. I don't know if you guys taking student, but if you're starting to, reach out.
I want students. We need to shape the way forward, right? So the way we treat our students, again, how we educate them is how we pump out good PTs in the future. So
will they need audition tape?
Yes, we're gonna need an audition tape. I need a reel, Instagram reels. You gotta send that over to me, and based on that audition,
what are the 3 dance requirement they need to do?
The three types of dances.
Yes.
I don't like to put a cap on it.
Okay,
kind of let it free flow. You can even combine different things together, make a mixtape of the dance moves.
No interpret dance. Those are sad dancing. Nobody wants to see that.
Well, no sad interpretive dances.
Sad.
It better be like Pharrell, like happy. And
it's like no sad dancing.
None of that. So send the audition tapes. I'll teach you everything I got. That's again, our job is to push the profession forward, right? Get it out of being stuck 20, 30 years ago.
Yeah.
Right. We got to change the scene entirely. So again, whether you're a student, it's up to you to change the scene, just like it was up to me to change it once I got out of the student realm, and same for you, Natty. But yeah, let's change the profession. Let's make it juicy, hot, and also very, very beneficial.
I love it, man. Thank you so much for your time, bro.
Thank you, Natty.